Thanks for doing this. Can
Of
you tell
course.
me a little about how you became a PA and specifically why you chose that specialty?
So actually, I work in cardiac surgery.
Hmm.
So we work closely with the cardiologist, but I would specify that I'm in cardiac surgery, not cardiology. Like I said, we work closely with the cardiologist. There are primary referrers. So before all of our patients get seen, whether they come through the emergency department or either directly into our office, for the most part, they're either getting seen by a skilled, primary care physician or a cardiologist. That was probably the cardiologist was a referral from the primary care. So we work really closely with both cardiologists, cardiology PAs, and primary care physicians, primary care PAs. So by the time they make it to us, typically it's been determined that cardiac surgery might be in their future, right? So
Hmm.
what does that mean specifically? So for a lot of our patients, that means they came in either through the emergency department with chest pain or with shortness of breath, back pain. They were found with an arrhythmia. We found down. They passed out. They had a syncopal event. It could be a multitude of things, but most of it is chest pain or something like that. So in cardiac surgery, what are we doing day to day? Typically at the facility that I work at, we're doing 1 to 2 cases a day. And like I was saying, our primary case that we do, the most common, we ran the numbers from last year, just a couple of weeks ago, and about 50% of our volume is coming from coronary disease surgeries, coronary artery bypass grafting. So that's an open heart procedure that requires some sort of vessel conduit to bypass a blockage in the heart. So I always tell patients and people that I'm trying to, explain what this surgery is imagine you have two main hoses that come off of your heart that feed the muscles of your heart. You have an artery here that you can obviously see. So imagine that, but rather on your heart, and those can get blocked up. So what I always say is, everyone understands what a hose that's been run in dirty water. Eventually it's going to develop some sort of sedimentation along the edges. At least, for that analogy, that's most common. And then eventually that buildup is going to become so great and so significant that it's going to cause a flow reduction, everything past that blockage. And so when it comes to cardiac surgery and chest pain, that pain is actually coming from a lack of blood flow for the most part. And the most common reason is because of this buildup of sediment, but in the heart, it's calcium. So what do we do? Essentially, it's like a detour on a road, right? So if you're having you have a break in the road or a bridge is broken, what do? You have a detour. And so we're essentially providing a detour when we do that surgery around that blockage. So that is our most common type of surgery, is a CABG or a coronary artery bypass grafting. We also do valvular surgery, and we also do some aortic surgery, which would include, aneurysms, dissections, and then you may do a multitude of those things in one operation.
Hmm. Hmm.
So that is kind of, the 10,000-foot view of just cardiac surgery as a whole. So there's a lot of people that are involved in that procedure, and like I said, there's the referrers who are normally seeing those patients prior to them making it to us, and then by the time they make it to us, there's me. I'm a PA. There's my physician that I work with. His name's Dr. Byer, and so he's a cardiac surgeon. And so all of these cases that I'm talking to you about, he's kind of the the lead in all of them. Of course, he's the primary surgeon, but there's a lot of people involved, one of which is myself, another is anesthesia. We have techs, nurses, and then, from the people on the floor in the ICU, those are more nurses, intensivists. So it's a very large integrated team, all of which is kind of led by our surgeon, like I said, Dr. Byer. So imagine a large, well-running restaurant, right? That is kind of how you'd imagine a very well-run cardiac OR in general. Is you're going to have one person who's setting the agenda basically and ensuring all of the quality is met, and then you have sous chefs, and you have prep cooks, and you've got sauciers, and you've got dishwashers, and you've got everyone in between, servers. So imagine you have all these people doing all of these different roles to achieve this one goal, and the same is definitely true with cardiac surgery. And any break in that team dynamic can cause a hold up with all of these things we're trying to achieve. So it really is a really integrated and team oriented job.
Yeah, it definitely sounds like it. And when did you specifically kind of get attracted to surgery? Did you know in PA school, or did it something you kind of thought about in undergrad?
No, I thought, well, undergrad was interesting. So I don't know how much you know about the PA profession, but I can kind of give a brief synopsis of maybe my introduction into the PA. So that's kind of see, my trajectory is similar but a little bit different than most, because I had not really known about the PA profession prior to I think it was about the end of my junior year, maybe the beginning of my senior year, but even then I wasn't really sure what I was going to be doing. But my undergraduate degree is in biochemistry, and I didn't know that I was interested in medicine. I was actually very fearful of medical procedures. I didn't like the sight of blood. My sister and she'd watch TLC, and she'd watch plastic surgery and these operations and these TV shows, and she loved it and enjoyed it, and I couldn't stomach it. Somebody would cut their finger and I'd almost pass out. So I never thought that I would be where I am today. No chance. So that kind of brings me to undergrad. So I thought, okay, well, I really enjoy science. I really enjoy biology. I'm good at chemistry and math. So biochem, that makes sense. So I kind of just, continued to do well in classes, but really didn't know where I was going to end up. I transferred schools from Kent State to University of South Florida, and when I got there, I got into a lab and thought, okay, maybe I'm going to be a PhD, or maybe I'm going to go for my PhD or an accelerated master's, or I don't know, but I'm going to get in this lab and I'm going to see if I like it. And I did. I ended up in a lab. We were trying to determine what kind of drugs were effective for reducing plaque formation in Alzheimer's. So one of the characteristic, they're called tau tangles and amyloid beta plaques. So those are the two common buzzwords when you hear of drugs that are treating or used to treat Alzheimer's. So that's what we were doing, and I was a cell culturist, so I'd build up all the cell lines and I'd grow them out, and then we would basically test different drugs and different things on these cell lines that I was growing up. And I enjoyed it, but I didn't know if that was really where I wanted to be, because most of the people I was in there with were either going to do their PhD or they were going to med school. And I still didn't know I wanted to go the medical route and go to med school. So again, still conflicted, but my next semester I decided to take another opportunity just to see, maybe I like working in a kind of a hospital setting. So I I volunteered at Shriners Hospital for Children's Orthopedic Hospital, and I worked in the PACU. So this is a post anesthesia care unit. This is what PACU stands for. So the patients, they were young children, would come out after having an orthopedic procedure. Most of the time it was congenital or from an injury, and then the nurses would recover them. The anesthesiologist would come out and kind of work with them, and then my job was to help the nurses there and then help them move from the PACU into their rooms and where they would be staying kind of while they were recovering. So not a whole lot of responsibility, but I got to see
You got your
kind
foot
of
in the door.
I got my foot in the door, and I got to see, a lot of what was going on, and a bunch of different specialists, nurses, anesthesiologists, the surgeons would come in, and then you'd see the different types of nurses. You'd see the PACU nurses, and then you'd see the floor nurses, and then you'd see the specialists, and then you'd see the people who make the prosthetics. And so I got to see a lot every time I would go there. And what I really came to determine was that I really enjoyed being part of that team dynamic. In the lab, there was a team dynamic, but it was quiet. It was not spoken. There was definitely a team dynamic, but it didn't seem as fast. It didn't seem as integrated. It didn't seem like it was very stoic. So I really enjoyed being able to help everybody quickly. Oh, we need this really fast. Okay. And I like, that's how I am.
Yeah.
I'm energetic. I want to move around. I want to be in the mix. I want to feel like, okay, I'm helpful now. Right? If you ever worked in a lab, you could work 10 years on an experiment, and at the end of it, it fails. And that to me is something that I just wasn't, capable of wrapping my head around. I wanted to be able to help someone and know by the end of the day or the end of the case or the end of the week, okay, this person that I helped is getting better, right? I wanted a
Yeah, of
little bit
course.
more of that immediate feedback, and I also wanted more of that humanity, because there is a lot of humanity in medicine, and it's really what drew me in. And so the one thing that I wrote about in my admission essay, and the one thing I think about and tell people about, is one of my first days. We had this young man. He had his leg amputated from the knee down. He was probably 10, and it was his second or third failed operation. Before that, so this was kind of the last ditch effort to, so eventually it would have taken his life because it was chronically infected and they kept trying to fix it. And he was from, I think he was from South America. And so he wakes up from anesthesia. He's screaming for his parents. And I felt paralyzed. I felt like, oh man, I'm useless here. I don't know. I know a lot about, biochem and calculus, but none of this is helping me when someone is acutely ill and I'm feeling, okay, I'm not able to help this person and I really want to. And so that's the day that really kind of changed my life, changed my trajectory, and really forced me to think, okay, what can I do and how can I, help this person in the future or help other people who are in this situation in the future? How can I develop my skills? How can I learn the things that I need to learn to be useful to someone who's in need? And so that really led me down the pathway of considering, well, do I want to go to med school or do I want to go to PA school? And I think that's a bifurcation that a lot of people end up in. And I, of course, talking to you now, chose the route of PA. And so, there was a lot of
How did you
factors
make?
that.
Yeah, I was gonna ask you.
How
did
did
you
I
make
make
that
the decision?
Yeah, because it seems like, well, I actually I'm starting PA school in a couple of months.
Right. Where
Yeah,
at?
so either Arcadia, and then I have an interview for another program in New York called PACE, and so
Okay.
we'll see where it goes. But right now, as of right now, I'm going to Arcadia in Delaware, and I work. Obviously, you need the patient care experience and stuff like that. So the more I worked with providers in general, they talk to me about what led to their decision of physician over physician assistant or physician assistant over physician. And a lot of it's actually pretty surprising some of the answers you get. You know, it's I've met people on both sides that kind of see that the grass might have been greener. And so for a while, I kind of thought that idea too. Like as I was applying to PA school, I was thinking, I was like, you know what? I mean, could I take a year and then, you know, take the MCAT and take some classes that I'm missing? But ultimately, you know, I chose the path I chose. And yeah, I'd really like to know how you arrived at your decision.
Well, one of the ways that I informed my decision, you hear a lot about this laterality. You hear a lot about the ability to switch specialties, which of course is a benefit. That's definitely one of the considerations that I had. And in particular, I wanted to do one of these surgical specialties, at least at the beginning of my career. So the way that I thought about it was not necessarily about, being unsure about what I wanted to do and wanting to have the laterality of changing. It was more of, I want to have kind of phases in potentially, I don't know if this is going to happen, but one of the ways I consider it is, okay, I want to be in the mix for as long as I can, right? I like surgery. I consider trauma surgery, transplant, cardiac surgery, which is where I'm at now. And one of the binding features of being a physician, which is also what allows you to be an expert, is that you have to stay in your field. But if you have a family and you want to switch and you want to be more regular, or if you're, at 20, your choices, I think, are different than at 40. And I saw that a lot of the physicians that I knew, they were tired, they were exhausted, they were, if you're a trauma surgeon at the beginning of your career, it's really probably awesome. But then when you're 40, 50, 60 years old and you're sleeping on the floor in the hospital, it's like, that's a lot of sacrifice. And I'm grateful that there are people that do that and they want to do that, and good for them. But in addition to that, I have a personal instance that that kind of influenced me to choose this career so that I could bring that back, because cardiac surgery and all these other specialties, they ask a lot of you. They ask a lot of your body, they ask a lot of your time, they ask a lot of your emotions. And I wanted to, if I wanted to transition out of that and move into something that was a little more balanced, a little more regular, a little more 9 to 5, because let's just cut to the chase. My dad was always working, and he needed to, right?
Of course.
And he needed to. So at least that's, probably what he would have told you. He needed to. And at the time when we were younger, we weren't, wealthy by any means. And he had 4 children. He had his first really young. So he didn't have a lot of time to kind of build up any wealth. And it took him a while to find a career, right? He had a lot of jobs, and then it took him a while to find a career. And he did really well. He was a great role model, but I think he missed out on a lot. And I keep talking about him in the third person, or, past tense, because he eventually passed away, and he passed away young. And I think a lot of that had to do with how taxing all those years of needing to be at work 6 days a week, 70, 80 hours at a time, to, provide for us. And again, he did a great job of that. But I wanted to create more balance in my life so that I could not have to, miss out on the things that he had to miss out on, vacations and holidays. And so that was one of the reasons that I chose PA, is because I wanted to create more of that balance. And a lot of the doctors you'll talk to, they talk about, they're maybe a little bit envious of PAs because they do have more balance, or they don't have as much administrative burden, and they don't have as much responsibility placed on them. And again, that's a choice, and I'm glad that a lot of physicians do make that choice, because we absolutely need them. But for me, I wanted to create more of that balance, and I thought PA would allow that.
Yeah, that's really interesting. You mentioned that. I also my father's still with us, but he also had that thing. I'm one of four,
Mm-hmm.
and when I was younger, my father would work like that 6 7 days a week. Honestly, he'd probably still be doing it if my mom wasn't hounding him not to. But yeah, I mean, I think that ultimately led me from the same decision. I felt that if I would try to be a physician, it would not in a negative way, but take over my life. And I
Mm-hmm.
thought that there was no like mobility in terms of like taking your foot off the gas and that type of thing. And I like things like I want to do this podcast. I like talking to people, meeting different people. But I feel like if you're gonna go for that MD or the DO, and you'd want to be very, very dedicated to your craft. And it's not that I'm not in general. It's just I think you're exactly right. It's kind of a balance of things like that. Like you don't want to miss out on things, especially when you have someone in your life that's shown you that while those sacrifices are very admirable, there's no light without dark.
Mm-hmm.
Everything comes at a cost, and it's really interesting you mentioned that. But no, that's definitely very insightful. I know it's very hard. I mean, I've known from experience now too. It's very hard to get into PA school too. Is there anything you kind of did to make yourself competitive? You mentioned volunteering and during that research. Is there anything else you kind of did to stand out?
Well, I think my degree was helpful. It was different, biochem. I think it stood out maybe a little bit. That, and I also did really quite well in my undergrad. Um, so I think the biggest things, probably first and foremost, because I do a lot of personal statement reviews. I do a lot of application reviews. I try to help as many pre-PAs as I can. In addition, I do mock interviews a lot, more in the fall and the winter, when most people are kind of interviewing. But uh, what the big levers for getting into PA school, number one is what are your grades? All right, you can be really smart and not that charismatic, and be an okay writer and get into PA school as long as you apply on time. Right? You can be middle of the road in terms of your GPA, maybe 3.5, 3.6, even 3.4. Be an okay writer and be a really good interviewer or interviewee. Right? So those are or you can have a relatively low GPA. You can really be a nice writer, right? Because those I see those people occasionally, but then you also have to interview really well. So if I was going to give weight to what is the most important is pretty simply just your intelligence or your dedication or because GPA is not necessarily a reflection of your intelligence. So I shouldn't say that, but I think it reflects discipline and intelligence. And you can be really disciplined and do really well and have a great GPA, but it's harder. Or you can be really intelligent and have a really nice GPA and not have to work that hard. Or for the most part, most people is you need to be intelligent and disciplined.
Yeah, yeah, I completely agree. I
Yeah.
definitely like there was in the beginning of my college career, I struggled a lot because of I'm honestly like being undisciplined. So at one
Hmm.
point in community college, I had like a 1.89, 1.9. But after,
Yeah.
applying myself, I think my last like 80, 90 credits were 4.0.
Hmm.
And it got me right to a cumulative GPA of like on CASP of like, they take everything like a 3.5 something. And then my
Right.
science was good, but it really showed me like how competitive it is because not in my mind, but like you see, for years I was doing good, and I was like, all right, like things are fine, and then you get back that CASPA GPA and you start seeing the numbers, and you're like, oh, like I need to nail other things on my application,
Yeah.
and especially as a first time applicant, and I think I have relatively low patient care experience. I think barely over 1,000 hours, but I didn't want to wait any longer to apply.
Right.
But yeah, I think it's really important to try to do things to differentiate yourself. I mean, at least in my experience, I think that helped me a lot. Like, I ran marathons, I like fitness, and so I think it kept me level headed and helped me
Hmm.
honestly handle with some of the stress because, I mean, as you know, sometimes you're taking orgo and then you have work and then you have your PCE and then you have to apply and it's
Right.
just like, and it's all
Right.
a
You
bunch
don't
of
run a
stuff.
marathon without discipline.
100%. It took
Yeah.
yeah. Do you do any like activities, lift weights or anything like that outside of, medicine?
Yeah, every day. Or I try to do something every day. And I ran a marathon in the fall, and that was tough. But yeah, I always tell everybody what is my piece of advice to people who have been admitted, who are going to go into PA school, and they have a little bit of a gap, right? They got in January, they got in November, whatever. Or they even get in right now, and you're starting in May. What do you do? Well, I always tell them, get yourself as healthy as possible, clean yourself up in terms of sleeping, your sleep hygiene, get on a schedule, go to bed at 10, wake up at 6, or go to bed at 11, wake up at 7, and just start dedicating yourself to that. And then just read. It doesn't matter what it is, read something. But you have to, a lot of us get, they you start to, if you don't use it, you lose it.
Of
And
course.
if you've been out of the education space, or you've been out of school, you start to not read as much. And especially since you're on your phones a lot, myself included, you're reading small little you know
Destroying your
bite
attention
sized.
span.
Yeah, your attention span is not great. So what do you need to do? You need to kind of rebalance that. You need to start reading, even if it's a magazine. Read for 90 minutes every day, right? Get yourself healthy. Figure out what that looks like. Find ways to make yourself efficient when it comes to eating, drinking enough water, sleeping. So it's a lot of that is all for me discipline. And if you can't do those small things, everything else starts to spiral, right? If you can't get your groceries and have all your food prepped on Sunday, for me, okay, now I've just lost 5 hours in the week. Now I have to make a meal every day, or I have to, on Monday after I'm tired after an exam, I have to go to the grocery store. Or, so it's creating the habits before you start introducing even more to your plate. Because if you
Of
don't have
course.
that foundation of what's going to keep you, planted, and what's going to keep you steady, then you start to add all of this, because PA school is a lot of volume. If you start adding all of this stress, and you don't have something to balance you out or de-stress you, or you can't create space to take a 20-minute walk, then you're going to be in tough straits. It's hard. So
Yeah.
people who have that balance or create that balance prior to starting PA school are going to be in a much better position than those who don't.
Yeah, that's definitely solid advice. Yeah, I knew I'd go like stir crazy if I didn't start like something, whether it's reading. I started boxing. I started an improv class. Like I
Hmm.
need to be like stimulating my mind. I can't just like obviously I have a
Hmm.
job and stuff, but I can't sit. I don't know. I can't sit still. Like I need to be doing something. But
Right, you and me
it. Re-
both.
yeah. So how did that marathon go for you, if you don't mind me asking? What was your time like? What was the
Oh, it was
experience like?
bad, but I just wanted to finish.
Of course,
So
yeah.
I wanted to hit about 4 hours. 'Cause I only give myself right around 3 months of training.
Hmm.
And before that, I had ran probably about 0 miles in a whole year. So it was more of just getting myself to get into the flow and do my Sunday long runs and do the pacing and this and that. So I wanted to shoot for about 4 hours or sub 4 hours. I ended up not getting that, but I was pretty close. So I did my marathon in New Mexico, which,
Hmm.
to my surprise, is much higher in elevation than I would have ever considered. I mean,
Oh
everything
yeah.
about New Mexico kind of shocked me because I live in South Florida, so I'm at 30 feet of sea level here, and I'm
Uh-huh.
actually relatively high in terms of, sea level. Most of Miami is just a few feet above sea level, and Fort Lauderdale. I think my headphones died. Mexico was 5,200 feet above sea level, super
Hmm.
dry, and I'm running the Rio Grande River, which is a pretty interesting route. And all my training was in July, August in South Florida, so it's 100 degrees, it's 65%, 70% humidity, and then I get to Albuquerque, it's 45 degrees, and it's
0% humidity. It's drier than a bone. Uh, and so the conditions were pretty interesting. And then the elevation, of course, was unique. And I didn't want to, hopefully this doesn't sound like an excuse, but I was more interested in finishing my marathon because, and just being healthy and being able to, um, we had planned to hike, my friend and I, to hike 2 days later, the Sandia Crest, part of the Sandia Crest Trail. So that was
Hmm.
another 20 miles. And so 2 days later, I did a 20-mile hike up the Sandia Crest. And so that was the real challenge. My feet
I was
were
gonna
hurting.
say, yeah.
Oh man, my feet were hurting bad, but it was totally worth it.
Yeah, 100%. I've run in total now. Six. I've run in Buffalo. I've actually run in Florida. I ran the Miami Marathon at the beginning of 2023.
Yeah,
Yeah, they're all. I'm not a good runner. I've never broken 4 hours, but I always try my best. I try to keep healthy.
yeah.
I recently actually I just signed up last month for my first ultra marathon. I figured since I have a bit of time for PA school before PA school starts, like I'm gonna really, really crank it up. And so
Hmm.
I signed up for my first ultra. Nothing crazy. It's like a 50 kilometer, so like 32, 33 miles, I think, something like that.
Hmm.
But I really wanted to test my mental, like, you know what I mean, like because it hurts to run. Once you hit the 22-mile mark, everything starts hurting.
Yeah, that's
Everything
how it
starts
was for
hurting.
me. 20 miles, I was like, oh man, because the 20 miles was the longest training run I'd ever done, and so 20 to 26, I was like, this is all. I had a lady tell me, she's my neighbor. She had run a bunch of marathons. She was saying the first, the first, the first 12 miles or the first 10 miles is with your legs. The second is with your head, and the last stretch is with your heart. I was like, yeah. When I was running,
Solid
I'm thinking
advice.
that's great advice.
Yeah, yeah.
So
Um, are
yeah,
you going?
yeah. So I was saying, that's kind of my trajectory and how I ended up in PA school, and like I was saying, I do a lot of these interviews with people like yourself, but you're already admitted, but pre PAs, um, and so we were talking about the big levers for what distinguishes you. So a lot of people they fixate on the GPA, and then they ask me, what should I do to bring my GPA? It's 3.3. Um, what should I do? I've applied 3 times. This is my fourth time, or I've applied twice. What do I do? I don't know what to do. And so a lot of people are fixated on the GPA, and maybe they retook some courses and they did much better, but it doesn't seem to be making a difference. So if you're going to consider more coursework, what I consider to be more important than retaking courses that um, maybe you got higher than a C on. So I wouldn't recommend taking anything if you got a C plus, maybe you could retake it if you've got extra money and time and you really want to polish up your application. Um, or if you have multiple, could consider it. Some people take post baccalaureate courses, but I think even more important, because they're categorized differently, is maybe a short master's program, or even coursework that is not necessarily required or a prerequisite, but a course that you never took before, something that you might be interested in. Like, say for me, I took immunology. I wanted to continue to take some coursework. It was a prereq at one place, UT Galveston, University of Texas in Galveston. Um, I didn't necessarily need the GPA boost, but I wanted to maintain kind of the scholastic thinking, and I wanted to keep going to school Tuesday, Thursday. So if you're applying in April of this year and you think you're on the fence, um, don't think that between April and November, when they start to reach out to people, that they're not considering what you're doing in the meantime. So a piece of advice would be, say, again, if you have a 3.4 or 3.5 GPA, would be to take 1 or 2 more courses and get A's in them. different courses, because if you take the same course, all they're doing is averaging your total. So if you take organic chemistry 1 and then you retake organic chemistry 1 and you get an A, so now you have only gotten a B. So you really haven't changed much in your science GPA, and maybe you'll be able to explain that you've done much better and you've learned more. But what I think is even more impactful, and definitely is more impactful to the pure math of it all, is to get an A in a course that's not related to something you've already taken before, immunology or pharmacology or pathophysiology, something that you're going to be taking in PA school already. So you get a leg up on it. You have more time to digest it. If you think there's something you struggle with, you had a hard time with biochemistry, then taking a pharm course or something similar, intro to pharmacology, is going to be super helpful, because you know you're
I'm
taking
sorry.
pharmacology.
I'm just gonna. Sorry.
Go ahead.
I apologize about that.
No.
You were talking about immunology and other courses to take.
Yeah, I think if you're going to do something, take something that you haven't already taken. Or if your GPA is really dragging, if you've got a 3.3, if you got a 3.4, if you've had a hard time, you've applied once, you didn't hear anything back, or you applied to a bunch of schools your first time, you got declined from all of them, or you applied a second time, what I'd recommend is a 1-year master's and get a really high GPA in that, right? Do really well, because everything else, you just start layering courses on. It's helpful. I've kind of recommended it, but it's more of the structure. Okay, if you really, like, I'd say this is more important for somebody who's probably in the 3.2, 3.3 range, to take a master's and get a 3.8, 3.9, because that's going to show up differently on your transcript. It's going to come up as a master's, so they're going to see a different GPA. So and it's all about trajectory. That's really what it is. So if you did poorly in your freshman and sophomore year, and that's what's hurting you in your GPA for undergraduate, if you then continue to do well and take a 1-year master's public health or something similar, and you get a 4.0, it's showing that upward trajectory, and they're going to put way more weight into what you've just done than what you did as an 18-year-old. So
Yeah.
if a lot of people get hung up on what to do, and then they end up doing nothing, which is pretty common. You get paralysis analysis,
I was just about to
paralysis
say
by
that.
analysis, right? So they get stuck, and then they don't do anything. In addition, most people are really bad at interviewing, and it's not a to be mean, I say that, but most people that are applying to school haven't developed the skill of chatting with random people, or just chatting in general. Obviously, you've been very good at it, and I don't know how you developed that skill, but for me, I was always comfortable talking to well, not always, but I developed my comfortability with strangers as a result of me working in the restaurant industry for a long time. Those were my first jobs. I was a busboy, and I washed dishes, and I served tables, and I sat people, and I did events, and I did that from when I was, that's what my father did. So I really started when I was like 12, and then I did
That's
that all
really
the way,
interesting.
yeah,
Because
did that all the
I
way
have the
up
same story.
into my 20s. So if anyone asks me what kind of skills or what kind of job young people should get, or if I'm talking to people who are younger than me, and they're in high school or whatever, people at the gym or wherever I'm at, if they're asking me what kind of a job they should get, I always recommend a service job, no matter what you want to do. If you want to do sales, if you want to do business, if you want to do medicine, anything really, you have to be able to chat, and that is a real skill that most people who are in the pure sciences, they just don't have. And I think it's more important for us as PAs to have that skill, because we don't have as much of the knowledge. So a lot of times PAs end up being doctor translators. I think that's actually one of the talents that a lot of PAs have is they aren't so scholastic, which can, be harmful but helpful, especially if you work really well with an older physician who might be, super, super, super smart, and they have a hard time bringing themselves to the level of a patient. So so a lot of times I've actually felt this way where we're able to spend a little bit more time with patients for the most part. Again, you don't have that administrative burden. Um, you don't have the meetings necessarily. So you should be spending more time with your patients, at least in a hospital setting, I think. So you have more time to then elaborate on what the physician says, because you're going off a lot of times what they're saying as well, because you're working as a crew. So they walk by, they have 3 minutes to talk to each patient, they say things, and they walk by the room. It's my job to now go back in the room and spend 20 and explain exactly what's happening in a level where they can understand, or that we find you know, which way of communicating allows them to understand. So I think for PAs, it's even more important to be able to communicate more effectively, because you don't have that degree next to your name that's going to give you, more of that authority. People aren't going to inherently trust you as much. So you have to convince them to trust you, and you should have the knowledge base to be able to convince them. But they're going to take a little bit more convincing. And how do you do that? You need to be kind of a good talker. I
Yeah, yeah. No, I was gonna. Sorry for interrupting before, but I was gonna tell you like that's exact. I have a very similar. It's funny how some similar stories we kind of have.
Yeah.
I when I was 15, I had my first dishwashing job, busboy, and then I became a server until it was time to get the patient care experience type of jobs. And
Yep.
I do think it's incredibly important, especially if you see it. I'm a little bit younger than you. I think I'm 23. So if
I'm
you see
29.
like
Yeah, I'm 29.
29. Oh yeah, just a bit older than. But like if you see, people my age, 23 to 20, like that, the whole COVID thing, there's a big gap in kind of just social fluidity of being able to kind of sit down and speak to people. And there's this kind of push for it to be more accepted almost in like around like in my generation that no, that's like it's fine. I'm like it's not that fine if you have to interact with people, that you don't know. I mean, obviously like it it takes time to develop, and again I'm always looking in better ways to develop it. Like that's part of the reason I joined that improv group, is because there's a bit of anxiety when you go and kind of like do these scenes in front of random people you've ever met, and the
Hmm.
quick thinking and stuff like that. I actually read it in a book by a salesman that is really good to kind of get your brain stimulating. But it's yeah, doing that really helped me a lot. Do you run into the same kind of, I guess, issues with that people bring up to your kind of business, that they have problems kind of sitting down and being good interviewees, as you say, with kind of feeling awkward or maybe stumbling over the words or maybe having trouble articulating what they mean or exactly how they feel about the PA profession when they're interviewing in these schools?
Yeah, for sure. So what I try to do more than anything with my interviewees is people meet with. I try to not so much ask them a whole lot of questions, but what I'm trying to develop in them is more confidence, because what a lot of people run into is they've already talked themselves out of having a good interview. So they put more weight into their personal statement, they put more weight into their GPA, but if you can really nail the interview, you can make up for a lot, I think, of a deficiency, especially if you make a connection with somebody important, that is an interviewer, and they have a lot of weight. We think it's this algorithm or this robot that's choosing whether or not we get admitted, but it really is a human being. So a lot of it comes down to connection, and so that's what I focus on is trying to build confidence. And the way that I do that is to try to work with them to determine what their story is and how to sell. Really, I pitch it a lot of times as selling, and I go, you're selling yourself, and in a lot of ways I use the analogy because everyone can understand it, is a used car salesman. So when I'm pitching how I want you to pitch yourself, I always go, well, what is a used car salesman? What is their number one talent? Is telling a story about you in this car, right? If they're really good and they're able to sell even the luxury car or a regular car, any sort of car, they're selling you a story, right? And then how do they do that, right? They might pitch you, okay, I'm in Fort Lauderdale, Miami, right? If you're selling a Corvette, how does this guy sell you the car? He creates this image of you driving down the highway or driving down A1A right on the beach, sun in your eyes, you're wearing sunglasses, you know, it's beautiful. You see the waves crashing to your left. It's amazing. And you're going to have, you know, coffee with your friends down in Brickell, right? So he's selling you a story, and then what does he do? He brings it back to, because if it's a used car, it's not perfect. So he brings you back to, okay, it's never been in an accident, clean interior, oil changes have been done perfectly. We've done this many point inspection on the car. The emissions are great. Exactly. You know, he gives you 10 things that you can feel confident in, right? So those are the things I'm trying to elaborate on, so that they will do that for themselves. And then when they bring up the negatives, because everyone who's buying a car wants to buy it cheaper, right? So you're going to bring up, oh, well, there's chips in the paint. Okay, we can fix that, right? But biggest issue is there's no real structural damage, so fixing the paint is going to be really easy. Okay, well, there's a stain on the interior. Okay, well, you know, everything, all the electronics in here work, so the stain was just merely a surface stain. You know, we can have that cleaned for you at no charge, right? So you understand that there's negatives, but you're able to then move it into or tell them, okay, this is how I'm fixing it. So what I always tell my students, I call them students, is to know where you're weak. And so I ask you, tell me your greatest weakness, right? And they might say, okay, well, it's my GPA. And then you can tell me, what are the courses you did poorly? And I always want them to be specific about why their GPA is 3.2 and acknowledge that it's 3.2, right? I didn't do well in organic chemistry the first time I took it. My freshman year, I basically got over my skis. I wasn't disciplined. I got a C in this course. I got a B in this course. I got a D in this course. But if you look at my transcript from more of a holistic point of view, my first, like you, right, you told me, my first semester I did really poorly, but my trajectory is that of one who's going upwards, right? If you look, sophomore year I did better, right? I got 3.7. In junior year, I got a 3.8. In senior year, I got a 3.9. And now I'm taking an additional course because I'm very interested in going to PA school. And I want to maintain my literacy, and I want to continue to learn more. And I know this course is going to help me in the future. So as you can see, when I'm in your PA school, your PA class, if you admit me, I've developed these skills throughout my undergraduate such that I'm able to, be disciplined, create space for studying, and also, as you can see from my transcript, do much better across time. So I know that my trajectory is that of someone going upward. So I know that my first semester of PA school is going to be much different than my first semester of undergrad. Right? So those are the kind of things that I'm trying to teach people how to utilize, is know what their deficiencies are, but pick one, right? If they ask you, pick a negative that you can demonstrate is improving, right? Because you always want to show improvement. I always tell everybody that 20% of your negative connotation response should be that where you're explaining the negative, and then 80% of it is demonstrating how you're improving upon it, right? So that you end projected forward in the future with a highlight, right? So now you've created that vision that used car salesman is so good at creating, right? Of you winning, right? If you're in the
Yeah.
Corvette and you're driving down A1A, you're winning, right? You got the music on, it's a beautiful day, you're winning. So you're demonstrating that to the interviewer that you are a success and you will be a success. So you should trust me even though I have this deficiency. All right? Does that make sense?
Yeah, yeah, that makes perfect sense, to be honest. I feel like confidence and kind of gearing students in that way is a different method you don't hear a lot. And honestly, when you're talking about the people around my age, I think that it's a very, very important thing to kind of help them with and help, I
Yeah.
mean, honestly, help us with, because I know a bunch of people that were kind of in my predicament, especially at the time when I had that GPA. It was very hard to kind of find confidence in yourself and your ability to handle certain courses. I remember when I went from like a 1.9 and then I had my first good semester and then I saw my GPA go up. And then like I got in the range, I'm like maybe I can really do this, like, and but I remember what it felt like to have very low confidence in my scholastic ability. I've always been okay at kind of talking and I'm trying to get better at that, but as far as my academic ability, I did have some questions at a time. And I think if at that time someone had kind of not called me out, but kind of asked me to explain it, it would have been very tough for me. But now I do think that I've built up a certain level of confidence in talking and explaining that time in my life. I have no kind of problem acknowledging what was happening at the time, whatever it may be, and then explaining, like you said, more emphasizing on what I did to overcome those things. So whether if it was time management, okay, draw up a schedule, or whether if it was maybe you're going through something mentally, okay, stabilize yourself with exercise, sleep, what we talked about before, and develop those skills, become more efficient, different study methods, stuff like that. Maybe what works for you doesn't work for everyone else, so you kind of just have to figure it out, for lack of a better term, and adapt to your. I think adaptability is a big thing too, because I mean, I'm sure as you know, like things happen. Sometimes something just comes up, but you adapt to it. You don't let it kind of roll you over and keel over and kind of just be like, oh, I don't know. No, all right, what's the situation? How are we going to deal with it? And stay calm. Not everything goes perfect, but that's okay. Like that's life. And I think that you only know that once you kind of go through some things,
Right.
and once you can go through those things, you can explain it to people. You can explain it to, someone you just met, or an interviewer. And I've definitely met a fair amount of people while I was at undergrad that, when you brought up GPA, there was either a very shyness, like you'd start seeing them hide away almost, or very defensive, where the 20% of acknowledging it becomes like a zero, and
It's
then it's a
pain,
whole
yeah. They cause them pain.
a hundred
And then
percent.
they can't get to the positive because they can't get past the negative. So that's why I always have, particularly, I've worked for 2 years with students, and this is kind of something that came out not at the beginning. I didn't know this at the beginning. I did more of the question answer, and it ended up not being helpful. So I had to change my method. I think it was helpful, but not that helpful. But what I realized is that people were having a hard time, particularly with any question that had a negative connotation, and then they would end up telling me a positive, but then trying to frame it as a negative, right? That, oh, I care too much, or I study too hard, or I do too many things. It's like, that's not a negative. That's just what you need to do is acknowledge what really the negative is inside of that, which is you have poor time management, or you have a difficult time saying no to too many things, and then you end up failing at everything, right? So you're doing two things bad instead of one thing good, right? So a lot of that is it takes some time. So most of the hour that I spend with people is trying to figure out what are the things we need to talk about, and it ends up being like 3 questions that I ask them, right? It's this negative connotation, and we work for a long time through that, and then it's what we need to figure out your strengths, right? So that takes some time, and then you have to then be able to pitch that strength in a way that I believe it, because most people will tell me their strengths, but they'll simply explain it to me in words, and then you end up not hearing what they're saying because they're just kind of, I always call it the manual versus the novel, right? Would you rather hear somebody reading an IKEA manual or have somebody read you a novel, because the way that you're describing yourself sounds more like a manual, because it's devoid of any story, it's devoid of any character, it's devoid of any emotion. So what we end up doing is then figuring out what these characteristics are that are distinguishing about them, and then we connect that to a story that then can be memorable, because our brains remember stories. I used to have a cardiologist. He was a great guy. His name was Morton Diamond, Dr. Morton Diamond. He was our program medical director at PA school. And the way that he would teach was in story. And he was an older guy, and he loved English. He loved reading. He loved writing. He was, wordophile or whatever he called himself. And so he would tell us stories about a woman who's walking through the mall, and she's got a stroller, and she's got a young child, and she's from this part of the world, and and then he'd kind of go on a tangent. Oh, I hate this place. It's full of people. The crowds are horrible. The noise is just unbearable. But I see this woman walking down the aisle, and she's got her child, and she falls, right? Mm-hmm. And then he would teach us about syncopal events that way, right? Instead of, this is the patient presentation, okay, this is what postictal is, this is the definition. He would tell us a story. And then, even now, I can remember all of these stories, which is what you want when you're interviewing. You want the person who has got your application to look at it in a week when they go and reevaluate in their meeting and talk about everyone. You want that person to open up your application and remember who you are, not remember the note they wrote on the corner of your page. You want them to remember the story, how you made them feel, how what emotions did you invoke in them, and why should they admit you, right? That's really the underlying kind of premise of the entire interview, is how do I convince this person to admit me? And why am I such a good person for this school? And why am I going to be a successful PA? And why am I going to give back to this community? And why can I create this vision of myself in this place that is going to invoke confidence in the interviewing panel, right? So that's ultimately what it comes down to. And most people have a hard time with that. And I didn't do the best job of that either. But it's taken me 2 years to kind of work with probably over 100 people at this moment to learn how to, in an hour, teach you how to succeed in an interview. That maybe you've had 10 of them before this and you've done badly on all 10. And then you have your 11th and you feel like it's night and day, which I've had people tell me. And it's not that they're doing badly, it's not the fault of their own, it's just that they didn't understand necessarily why.
It's hard to know what they're looking for. It's hard to know what they're looking for.
They also need to know, what is your purpose here? Mm-hmm. Your purpose is not to answer my questions. Your purpose, well, it is on the surface, but your purpose is to sell yourself, mm-hmm. is to invoke confidence in the person talking to you. It's to receive an admission. And how do you do that? You have to paint yourself as someone who's successful, someone who's going to give back, someone who's going to be a good representation of the school in the future, someone who's going to be a future preceptor and take on other students, someone who may even be an educator at the school, right? Because if you're at a successful program, they're thinking of all of these things when they're talking to you at 22 years old, and they're considering whether or not they should admit you or not.
Yeah,
If you have a school that has a good 20-year plan, that's what they're thinking. And that's the place you want to go. That's the place you want to go.
No, for sure. That's definitely, wow, that's a lot to think about for like that. You know what? I guess I never, when you were talking, especially when you brought up my example, I was thinking, you know what? Like, yeah, that is pretty, like, if someone brought that up, that is the way I would try to approach it. But actually putting it into words, because obviously there's a little bit more pressure when it's someone in a position of authority, but performing under that pressure is definitely something you want as an ability. And at the same time, I noticed that you're a very well-spoken person, and I wonder, like, do you like read any particular literature, or like have you always kind of had like I notice your vocabulary is pretty like I don't know, like I like I like it. It's pretty rare, I would say, compared to most people, in their 20s. So
Yeah,
is there
I
anything
listen
you
to a
do?
lot of podcasts. I listen to a lot of the news. I listen to a lot of smart people. Um, I don't need to say any names or make anyone make this podcast contentious somehow. But
I
yeah, a lot
know,
of
yeah, I know. I mean, anything I would cut out if you want anything cut out. I know,
no,
like,
no, no.
especially with your job, but like, I'm just saying, like, I notice, I know, I feel like guys that work out and like,
Yeah,
literature
you
and
know
stuff
who I'm
like that.
listening
We
to.
all like, we all know who we're listening to. We're not allowed to say, but like, we all know. It's just like, I mean, there's some non-contentious, like Goggins. I like David Goggins. I love listening to David
Yeah,
Goggins.
but I don't speak like David Goggins on a
No,
podcast.
no, I know. I just like, though, like I always think like that's why I started like that's why I signed up for the ultra. I was like, I need to do like
I read Cam Haynes' book. So this is
indoor.
Endure. Yeah, so I
Yeah.
read the book, and so at the end of, I had just graduated PA school, and I had taken my pants, I had passed, and I had about a month and a half that I had no, time to kill. I was going to go see my family up north in Michigan and Chicago. I had some things planned, and then I was going to start my job in November because I had been hired before I graduated. So I knew I had a job. I could kind of relax. I'd already passed my pants. I read Endure, and I'm kind of at this, like you are, at this tipping point of, okay, I'm about to start my career. You're about to start PA school. I read this book. I hadn't trained for 1 minute. So I'm like, I'm going to run a marathon after I read this book. I had not trained. I wake up in the morning the next day, 4 in the morning, 3 in the morning, whatever it was. I put a headlamp on, and I go into the Everglades by my house. There's a loop that's it's it's like a gravel sand loop, and it's in a watershed. It's in South Florida. There's a ton of canals. I'm sure you saw when you did the marathon,
Hmm.
and so it's a protected area, no cars, and I have a backpack full of what I thought it was enough water and some food and dates and peanuts and these sort of things. And so I'm carrying all my own water, and I got this loop I have to do, and it's 28 miles around. And I start in the middle of the night, and I just start jogging and walking and jogging and walking and jogging and walking and jogging and walking until I finished. And it took me like 6, 8 hours, and I had no idea. Because again, I hadn't ran
Yeah, of course, of
five
course,
steps before.
of
But I
course.
read this book, and I'm at
It's
this
impressive.
point where I just finished, and I'm about to start something new. And I thought, well, now's the time to kind of reset my self, and I'm going to do this via this run and see if I can do it. And if I can, I know I am capable of more, right? If I
Mhm,
if
of
I
course.
can't, right, I still just need to work harder, right? So it's not going to dissuade me, but it gives you some confidence. I'm sure that your ultra will do the same.
Hmm.
So, yeah, that was kind of one of the things that I did in the middle there.
That's
But we were
interesting, man.
talking about communication
Hmm.
and how younger people your age, they're trying to normalize their inability to communicate. Right? That might be fine if you work with 23-year-olds. But
Hmm.
people at 23 don't run companies. People at 23 don't get heart failure necessarily. People at 23 don't get heart attacks. Right? They do, but it's the 0%. It's nearly zero, right? But if you are a PA, if you are a nurse, if you are a doctor, they have longer time to develop because they're going to be in school and fellowship and all these other things. So they're going to come out, they're going to be in their 30s. But a PA, if you're 25 years old, is going to. I spoke at FIU on Wednesday in their 20s, early 20s, some probably even maybe even younger, 20. And I was telling them that what is most important? What is the most important thing when you're considering patient care experience? And they were talking to me about hours, and they don't have that many hours. Should I apply? Should I not apply? Where should I get my patient care hours if I haven't started? So my recommendation about patient care hours, and it goes back to what we were talking about with talking, is you have to get quality patient care hours where you're going to be speaking alone with patients, whether that's just simply calling them back into a room. Hey, Mrs. Smith, you're going to be with me in room 6, and then walk back with them, make a little chat. Well, how was your day this morning? Right? You have to develop this sort of this communication style. And most people, they like, unless you did what we both did, where you're getting paid to be able to communicate, they're not going to know how to do that. So if you're a scribe and you're just a fly on the wall, it's a good experience. It's really nice for the knowledge, but it's not going to get you that communication skill. So if you can blend the both of them, that's where you want to be. And for me, I worked at a dermatology office where I was a scribe, but I also did the intake. I did HPI, I wrote it up, and they would come in and do it again, but I would be the one writing it as the scribe, and then I would start the ROS, I would talk to them, I'd ask them some basic questions, and then most of the time they'd come in and they'd ask the same line of questioning and they'd get a similar response. And so, we're asking the same kind of type of questions. I have the ability to ask difficult questions. I have the ability to go over maybe something that is hard for them, or have a hard conversation, or could be bothering them, and do that in a nice, tactful way, and then kind of develop that. Because when I first started doing that, it was really challenging. I'm in college. Even in the restaurant, you're not talking with people about sensitive things. You're learning how to talk about things that are small talk. It's nice, it's banter, it's a joke, it's a laugh. But then developing the ability to speak to somebody about an illness or something that could be hurting them, or a cancer, or a death of a loved one, right? Because they're coming to the doctor, and a lot of these people, these older people, they don't have a whole lot of people that they feel comfortable with, or maybe they don't have a whole lot of friends, or they go to the doctor to get some things off their mind, or they go there because they know they can tell you anything and you have that confidentiality, or maybe it's just because you're nice to them and they need to tell you something because they need your help, right? So that is a whole different skill.
Yeah, no, that's definitely true. I can relate to that. I was a medical assistant scribe for City MD, and it's, even at kind of an urgent care setting, there was a conversation I had with another 22-year-old guy who admitted some pretty shocking things to me and not to the provider. And I think it was because we just, we're both young, and we started talking a bit, and it was, and the same thing happened with someone else, and one was about mental health, one was about a kind of habit they had that was really bad, but it were both very, very sensitive topics, and it all started with, hello, how's everything going,
Right.
like, are you from around the area, that type of thing. And because they're in that setting, and you're in that, even as a scribe, and you're in that position of kind of, you're there for them, they can kind of feel comfortable with you. And ultimately, both those patients, because they felt comfortable enough with me, they ended up telling the provider, and some help was given that could be given there at a City MD or something like that. But I really liked that they felt like they could talk to somebody, because they were both young men. And to me, at least, I've noticed that I don't want to say there's not a lot of sympathy, but it's just that there's not a lot of outlets I see for young men that are going through certain things, whether it's mental health or certain things like that. And
Right.
I really like that. At least you could tell me, I've seen, like, not that I'm qualified or anything, but just to at least have it out there, and at least have me able to talk to someone that may be able to help them with a little bit of access or something like that, you know?
Yeah, imagine it had you had a scowl on your face and you were dismissive, whether or not they would even have opened up at all. And then from there, now that they've finally mustered up the confidence and the will to go see somebody for help, and the first thing that happens is they get dismissed. Now what happens? Who knows, right?
No, for sure. Exactly. That's a really That's a really good point, especially with the kind of data you see on young men, that feel that they have no options, and
Right.
that's a whole different topic. But anyway, you said you spoke at FIU. That's really interesting. So you spoke to college students?
Yeah, on Wednesday, they asked me to speak. They have a pre-PA club, and one of their members reached out to me at the end of January, and so after work on Wednesday, I drove down there and just gave a kind of a. I had given the similar speech, but online at FAU, which is another university, to their pre-PA club. So this one was a little bit more in depth. We got a lot more questions. It was in person, so I enjoyed it much better. We had about 20 people come out. It was a cool little event. I gave a day in the life, kind of some of the things we talked about, but I ran through a case. We talked about, we went through some photos. I talked a little bit more about how I got into PA school, kind of my experiences.
Of course.
Again, it was more of a formal kind of, well, informal, formal, but with a PowerPoint, so we had a lot of photos, a lot of things to show and talk about. Um,
That's really cool, man. Do you do a lot of public speaking in general?
no, not really. The majority of this, I wouldn't even call it public speaking, but I do a lot, like we talked about. I do a lot of these interviews with people I don't know, so it becomes a little bit easier. Um, I think in the future I'll probably do more public speaking. I enjoy it, but at the moment, the majority of my time is in the OR. Um, so it's not kind of conducive
Of
necessarily
course, of
to
course, of course.
doing anything like that at this moment. But I know a lot of my professors in the past, they worked in surgery or they worked, 3 days a week or 2 days a week, and then lectured 3 days a week. But yeah, it's something I enjoy, especially if it's helpful. If it's not helpful, I'm not interested in feeding my own ego, which is why for the longest time I didn't really charge anything for my interviews. I either that or it was some negligible amount,
Yeah, of
15,
course.
$20. But a lot of that was I didn't want to give anyone a product that I didn't think would be all that helpful. So I get in my own head, I was evaluating how the the cost versus what they were getting, and it was probably too low even then. But um, now I charge for services, so I do talk more, and I'd like to talk to larger crowds so that I don't have to charge, because I don't like charging
Of course.
for this service. But if I don't do it. Right, so it makes it sustainable. Because I really enjoy this, but if I don't get paid for it, I just can't justify
Of course.
spending 5 hours of my week creating Instagram content and LinkedIn content and speaking for 3 or 4 hours with people, taking messages. So even though I get paid less to do this than I would if I just worked more hours, I enjoy it. But I can't do it if it's not paid. And even then, I get conflicted. I see how much these other people charge online, and
Yeah, yeah,
I,
there's a
I
lot of people that kind of, I don't want to say take advantage, but it's nice to hear that you at least, that you're taking that into account because I mean, I remember when I was like, when I would be around the time where I would have like needed like I guess a service, something like that, that you kind of offer and these people offer. I was living off scholarship money in like a very small place that I was living at, and it was really hard. And those patient care jobs don't pay as much as
no.
restaurant jobs, so it was a
Yeah,
very hard
so
time.
I'm conflicted, but I've ultimately come to the realization that I can't provide any service if I don't charge anything at all. But what I always do is if I'm gonna do something for someone, I always make sure that I disclose to them that if they're not happy with what I'm doing, I'll send your money back in 2 seconds, right? I'm not interested in charging somebody, especially a pre-PA, because I know I was there. I got paid 14, 15, $16 an hour, and then how am I supposed to pay $100? Like that's 2 days worth of work you know. So
Yeah.
I have a hard time justifying unless it's worth it. But for the most part, I mean, actually, not for the most part. I've never had anyone ask me to send any money back. So I'm happy with the service I'm providing at this moment, and I know that it's different than what others are doing, and from what other people have told me that have had opportunities to do both. The way that I do it is much different. Most people have said it's better because I think like what we talked about. I don't want to focus on question and answer because I always tell everybody we're in 2025. You can have ChatGPT ask you unlimited questions. You can read books. You can have your mom ask you questions. That's not helpful. Same is true with personal statements. You can have everyone edit grammatically your personal statement, but until you have somebody who reads it, who understands what is going to make this different than the next one, or your personal statement stand out, then you're just wasting time. So I think for most people, the cost is worth it to whether it's me or not me, but you should evaluate who is taking the time to read your stuff and whether or not they're providing you the service that you deserve. But I always recommend if you're on round 3 of applying and you haven't reached out to someone, you've wasted way more money in applications and in sunken, cost. That just ask for help, because
Yeah.
hopefully the person you ask for help is going to be able to give you something that is worth way more than what you pay for it.
100%. 100%. That's
Because
a
you
really
apply
good
three
point.
times, that could be 10 grand. I mean, I don't know. With traveling and
For me, it was more like so I applied for the first time I think I submitted everything in June. June. But for me, I felt like it's the time. It's like, and I
time.
don't mean like the time to apply. I mean like that's a year more of my time. Like, I mean, I know I'm not old or anything, but at the time, like I remember, when I went to my advisor, my pre-health advisor at undergrad, he told me to, when I first got to college, when I first got from community college to when I got my undergrad, he told me to apply a year after, like right now, basically, this coming cycle. And at the time, I was like, I can't do that. I was like, I'll do everything I can do to get to apply as soon as I can, so I can start a few 5, 6 months after I graduate. And I told myself I wouldn't sacrifice certain things. Like I didn't want to like apply as I don't want to say a bad applicant, but a weaker applicant. I told myself, I was like, so in my mind, I was like, well, if I need A's or whatever, like I went online for every free resource on how to study efficiently. I watched a lot of videos on writing personal statements. I applied to every single patient. I reached out to so many different resources on how to become like the best applicant I can be at a certain time. And by the end of it, right before I submitted my application, when I talked to the same health advisor, he was like, "All right, you seem good. You're good to go. Like send in your app." And for me, it was like, oh, I knew it was there. I knew I could have it a year done in advance. And as you know, like a year in terms of salary, in terms of personal growth, what you can do in a year, in my opinion, is so underrated sometimes. Like
Yeah.
not even just finances, like how much you can grow, how many people you can get to know, what skills you can add, what fears you can overcome. I'm like, I can't waste that time. Like I just can't. But so I really think that service is a good way to save you from doing that.
Yeah, and since you were an undergrad still, you had somebody that was able to kind of tell you, do it, just do it right now, right? But once you graduate, that person's not there unless you're
Mm-hmm.
paying somebody to help you do that. So, you need that push. It sounded like you needed that push.
Mm-hmm.
And like you said, it's not necessarily just finances, but imagine you're making $90,000 more and you're hung up on 70 or 80 or $100. If that one interview can help you, or that one meeting to discuss your personal statement and your application as a whole would potentially net you an extra $90,000 in a year in a career that you want to be, to me, that investment's a no-brainer,
Mm-hmm.
right? And
100%.
and I feel like a lot of the people I meet with, they would say the same thing. Because most of the people I meet with, I don't know if it's selection bias or what, but most people either get admitted or get waitlisted, and they, in one shot, and they've most of the time applied 2 or 3 times and gotten nothing, and most of them are getting in, and the very few are getting waitlisted, and that's mostly because I think I wasn't able, and it's not a me thing, but we're not able, between the two of us, the person reaching out and me, able to do the intervention soon enough, right? So
Of course.
it's too late to have all of the opportunities. So now we're grasping at, okay, a wait list, or we're trying to get in on like the last 3 spots that are available out of 60. It's like, if we would have only done this 8 months earlier, or 6 months earlier, I think we would have been there.
Of course.
So a lot of that is timing, and that's what I talked about at FIU. Was timing is everything, because you can make up for a lot of those 3 levers: personal statement, GPA, interview, if you simply just apply earlier. And the reason is not, all these schools have rolling admission. If you are number 5 on the application list, that means you're number 5 to get evaluated, and you're good enough to get admitted, then you're going to get a priority on interviewing. You're going to get priority in everything. But if you apply, because I did this is why I emphasize it so much. I didn't apply till August. And the only reason I got in is because of my interview, I think, and the fact that I had a solid GPA. But a lot of it, I think, came down to my interview, which is why I emphasize the timing so much, and which is why I really put so much emphasis for me on trying to help people to interview, because that's where I think I'm the best, able to help others. Personal statements, writing, it's not as interesting to me, and I'm not as good at it. But helping people to learn how to communicate verbally and interview is something that I'm really passionate about, and I care more. I care about the personal statements, but I think that I'm best in service of others when I'm helping them learn how to interview.
Of course, that makes sense. That makes sense, especially talking to you now. It makes sense.
And I get
On.
fired up, man. I get fired
Yeah, I was gonna say that too. I'm like that too, especially like in a more informal setting when I'm talking about something. Like I like when I'm talking. My undergrad's in nutrition, and so like when I start talking about like fitness, nutrition, I'm like and explaining the importance of it and how it helped me. I get super amped up. I'm like, like it's the thing that will help you feel better, so you can pursue other things that'll keep you even more level. I'm like, I'm very much like that. But I did want to ask you something, especially, because, everyone goes through things and stuff like that. And I really wanted to get to, for you, what was kind of the most challenging obstacle you kind of faced so far in your academics or personal, professional, whatever you want to talk about. What was kind of the most difficult thing you faced, and how did you overcome it? Because from what I see, the ability to overcome things that life throws at you is something that it really separates you, from other people. Right. As a person, like the ability to do it or the inability to do it can be the difference between you going to PA school, med school, law school, whatever it may be. And so, yeah.
Right. So, they asked me about this on Wednesday. They were asking me something about how do you succeed in PA school? Mm-hmm. And I was telling them, well, you just do exactly what you're doing now, but you just have to ramp it up, right? And so what are you doing now to succeed, and how do you know if somebody is successful, and kind of what are the features that define a successful person in undergrad, in PA school? It's the ability to fail fast and learn quickly, right? So you want to fail. If you're going to fail, you better fail and learn fast, right? So you're going to fail, but if you can't fail and acknowledge it, so it's really more about failing and acknowledging fast than failing fast. But that's really what is going to allow I mean, I think that allows you to succeed in every aspect of life, but in school particularly, that's what most people are concerned with is PA school and how to succeed in PA school is to just find where the dead wood is, find where the inefficiencies are, and just burn it, right? You have to get rid of it. You have to acknowledge, okay, well, why am I not succeeding right now, right? So if you're not doing that right now, it's going to be hard to do it in the future, which is another thing I talk about in my interviews. It's always orienting everything to the future. So if I'm not finding my inefficiencies in my present life, I'm definitely going to be overwhelmed when I get to where I want to go. And so if you want to know what you're going to be like in the future, just look at what you're doing right now, right? And so that is definitely my recommendation, is to find your inefficiencies fast. If you're failing at something, whether it's health and fitness or sleep or academics, or you're not showing up for work the way that you want, you have to find out fast before it becomes a problem. Same with school. Okay, I didn't do well on my first exam. Why? Right? Don't wait till the second exam, because then it's already too late. Right? You have to find out at that first moment. You have to sit in that pain of failure and allow yourself to figure out, well, why am I feeling this way? Is it because I've failed, because that stinks, or is it because I didn't do everything I could have? Right? And then what is it that I could have done better? And then figuring it out, whether that's acknowledging it to yourself, which is the first step. And if it's not obvious to you, just like with interviews and stuff like that I do, some people think they're interviewing well, and then they meet me and they go, holy, you ripped me apart, like in a good way, right? Or you meet a trainer, or you meet, you think you're healthy, and then you go to your doctor and you get your labs and they're not what you expect. It's like that, okay, that person now, their job is to hold you accountable. So maybe find that person. And so, what was the hardest thing for me in school? School was never the problem. I always found school to be enjoyable. And I was good at school because I've done school, right? PA school is not new. So if you're good at undergrad, you're going to be good at PA school. Just do the same things, but just do them better, right? So if you had trouble in undergrad and you didn't have great habits, then figure out the habits, like I said with you earlier, figure out the habits before you get there. And if you don't do that, then you're going to have to figure it out while you're there, and it's going to be much harder. But for me, I enjoyed school. But things like planning and setting calendars and scheduling, I'm terrible at. It's too boring. I can't do it. Right? So I admit that. And what do? I find people who are good at that. And you have to reach out. So that's what I did. And most of the time they were, really organized women that I went to school with. And then they would share their calendars. They'd keep me accountable. And then what would I do? Because you have to give something to get something. Normally I'm able to speak well, like you graciously said earlier. So a lot of times I'm able to read something in a course and kind of summarize it quickly and simplify it, right? That's
That makes sense.
The essence of studying, I think, is just to be able to take a large amount of data and simplify it. And so I did that. So I acknowledged that I was not good at the efficiencies, and I would miss things, or maybe I would not miss them, but I would wait too long because I didn't know about it because I didn't read the whole syllabus, right? So you got to find the team, and you got to build that team. So the hardest thing for me, because school, like I said, is not that bad, and I enjoyed it. Pants wasn't too bad. I liked it, so it made it easy. And I like my job now, but it's nothing that I've been trained in for 4 years, or 20 years really, because I was in school from 5 to 24, 26, whatever, 2-year gap. So you're in school for forever. So you're good at school, but then when you go out into the world and now you have a job, in a job that's not necessarily scholastic. My job's relatively scholastic, but a lot of it is physical, right?
Mm-hmm.
I'm in the OR a lot, so I have to learn tactile skills. It's like, learning to play. This is how I always, the analogy that I use for my OR experiences, and be like, a lot of what it is like playing a video game with a new controller with somebody or a bunch of people who've been playing the game for 10, 20, 30 years, and you start and you just get killed, and then you get you
Yeah.
respawn and you get killed again, and you get frustrated. You don't know the controls, you don't know how to behave, right? But you have to figure it out, so you just have to keep, in the video game analogy, just keep dying and trying again and dying and trying again, and asking, if you're on a team and it's a team game, you have to ask your teammates to what kind of role can I feel that's useful one? How do I be helpful? And so when I started my job, I wasn't necessarily great at that. I think not as a result of me not trying, but rather like you just don't have the skills. You don't know what button to press. You don't know, so you have to ask and you have to fail and you have to ask and you have to fail, and that can be really humbling, especially, and it can be really hard and emotional. And surgery is a really kind of emotion. Not it might be at the beginning. It's kind of emotional. All the patient cases are all new to you. All the experiences are new. Everything is dramatic. Everything is a little bit, and most of the emotions are, you're anxious, you're scared, you feel like you're not good enough. So getting over that takes for me, it took a little while,
Mm-hmm.
because when I first started, I was not helpful, right? I tell everybody that's applying to jobs in cardiac surgery, I go, for the first few months, you are just in the way, right? You are actually, if you're going to be honest, you are less than helpful. You are, right? You're actually a hindrance. You're slowing everything down. You don't know what you're doing. You might be creating more problems than you're solving, right? So acknowledging that and being able to get over that with your ego, that I'm not good at this and it's going to be a while, is really hard. And it took me a while to feel confident in my ability and confident in, my usefulness, because it took a while to develop that.
Mm-hmm.
Right? It's like being an apprentice to a plumber. So you don't know anything, but at least no one's, on the table. It's
Yeah,
a little bit
yeah.
different. It's
Yeah, it is a
stressful,
little bit different.
but you're not helpful. You might be able to carry the ladder, right? You might be able to walk around with tools, and that's helpful. And you shine the flashlight. But the minute you start doing stuff, it's gonna, somebody's got to be watching you, and you've got to be evaluated, and it's gonna be a year or 2 years before people feel confident in you, and getting over that is hard, because for the longest time everyone's watching you and making sure you're doing everything okay, and then you may start to expect that, or maybe you start to resent that because you don't want to be watched or you don't want to be evaluated. I'm good enough the way I am, but maybe you're not. So maybe you're lying to yourself that you're not good enough. Maybe you're lying to yourself that you are good enough, but you need to be evaluated. So it's this mix of emotions of, trying to get good at something, that to me and to everyone around me is so important, and they're so invested in, and of course it's, could be life and death potentially. It's, you're never really put in that situation, but sometimes it feels that way. And with cardiac surgery, that really sometimes is, how it is. So that is a lot to manage. So that, for me, was much harder than school. School.
Yeah, yeah, it's funny. I feel, well, obviously, I don't have that pressure that you have, but I've had people tell me when I was in undergrad and stuff like that, well, oh, that's like so crazy that like you're doing XYZ for school. I'm like, but it's school. Like it's not not working outside. I'm like, we're sitting at a computer looking at slides or reading or regurgitating, whatever it may be
Right.
to study. And I'm like, I mean, it's not the most interesting thing at all times, but you do it. It's expected of you. And I think like when you sit down and you're like, I have to study biochem for a couple hours, then you just do it. But what you're saying, yeah, that seems a lot more like, all right, well, it's humbling. And then on another level, you kind of have to kind of go through that pain and grow from it. I think that's really hard for a lot of people too, that growing from something kind of hurting you, maybe especially if you're used to kind of winning in a way.
Oh yeah.
And so
You're
you're
not
like,
winning at the
yeah,
beginning.
yeah. It's hard. It's easy when you're winning, It's not that you were losing or anything, but like it's easy when you're up, when you're
Oh
like
no,
the
you're
score's
losing.
up.
You feel like you're losing. Like, man, and then to have somebody come in who's got more experience than you and just like do it so simply. And meanwhile, you're sweating doing it.
Of
Your
course.
emotions are getting the best of you. You're getting anxious. You know, that is to me where you start to lose because you get emotional, you get riled up. But if you don't get those emotions, then I don't think you can change. I mean, so it's like this balance
Yeah.
of emotions and failures and success, but then right after the success is a bigger failure, and then you go
That's
on this
life, man. That's
you're
life.
on this
Yeah.
roller coaster. But ultimately, I felt that way because I cared about what I was doing.
Of course, yeah.
Um, and if I didn't, I mean, I don't know. There's no way I'd be able to make it through because my ego is just getting crushed. And
Yeah.
just now, it's like I think I tell everybody I'm trying to write a paper about cardiac surgery and new grad cardiac surgery getting a job. And I had a conversation, I think it was Monday or Tuesday, with a woman who's just finished PA school, and she was asking me kind of like, what is the timeline to feel comfortable in the OR, or how do you get a job? I don't remember what the exact question was, but I'm like, for the first 6 months, you're kind of in the way, right? At least in the OR. You can be
Hmm.
helpful other places, and that's what you should really try to do. You should try to be as helpful as you can so that people are tolerant enough to help you where you need the most help because you're helpful other places. You're pleasant to be around. They want to help. 6 months to a year, you're going to start being a little more helpful, and maybe you're at, I don't know, 20% efficiency. And then a year to 2 years is where you really start to feel more confident. And then, at a year, you might still get slapped in the face, and it's going to take you all your might to try to get, you know,
Of course.
to succeed in this small task. But then, by the end of year 2, it's like, no, I've seen that coming. You might still have a hard case, but you know how to regulate yourself. Okay, I've seen this before. I can think through this. I don't have to get emotional. It's just like doing anything. The more you do it, the more confident you are. And I tell everybody it's about 2 years for cardiac surgery to feel like, okay, I can probably take on any of these cases, and it's going to be hard, but I don't need to, lose sleep over it. I don't need to
100%.
panic. But I just need to, be focused, be present, um, you know, be there, and just be ready to work. But so that's what I always tell everybody. Like between 0 and 2 years, it's like good
You're
luck.
developing. You're
Yeah.
developing those kind of. That's good. That. Yeah. No. That makes sense, especially with something as complex as heart surgery.
Right.
Um, I think we can wrap it around here. But you know what? I really want to thank you, man. You've been
Yeah.
very insightful, especially as someone has just at the start of their PA school kind of experience.
Right.
It's really nice talking to someone that has some good insights and is up to a decent amount of things too outside of their career. Um, the you know so thanks for coming on. I'm gonna stop the recording.
This video is intended for entertainment and satirical purposes only. The content shared in this video represents personal opinions and humors and is not meant to be taken as professional advice or guidance. This channel and its creators are not affiliated with any professional or educational institution. Viewer discretion is advised, and any resemblance to real events or persons is purely coincidental.